how are you doing today?
I'm doing good. How are you?
I'm doing pretty good. My name's Taylor and I'm going to be your nurse today. Here's your discharge plans and we're going to go over it so you can just follow along with me, and if you have any questions just let me know.
Okay.
What is your name, date of birth, allergies, and any medications that you are on?
My name's Sarah Swiskid. I was born on June 26, 1984. I know that I'm allergic to penicillin, but other than that, not that I know of. I try and take a multivitamin every day, and I also take birth control.
Okay, well Dr. Tan already knows that those medications that you are on, but you can consult Dr. Tan if you have any other medications or prescribed medications that you're planning to take. I just talked to Dr. Tan and he is prescribing you a drug called Amiodarone. It is an 800 milligram tablet that you will take every day. It is important for you to take this how it is exactly prescribed because it is known as a high alert medication. This is for the tachycardia, which is a rapid heart rate that you are experiencing. Your last vital sign was 172. You also need to make sure you monitor your pulse and notify Dr. Tan of any abnormalities.
What would be considered a normal pulse?
A normal pulse is around 60 to 100.
I was curious, sometimes when I take my medications I have an upset stomach. Is it okay if I take it with breakfast?
Yes, I'm glad you asked that. You can take it with food, but you cannot take it with grapefruit juice. Do you have any history of heart failure, trouble with liver or lungs, eye surgery, or thyroid disorders?
No, I don't.
Okay, well, you need to make sure that you take this at the same time every day.
But if I forget to take my medication, what do I do then?
If you forget to take your medication, you need to not take it at all that day. If you miss 2 doses in a row, please contact Dr. Tan. A common problem with amiodarone is that patients do not continue to take the medication because they do not think that it is working. You should notice the effects of the drug after a few days. Some common side effects you may experience are dizziness, fatigue, malaise, bradycardia, hypotension, anorexia, nausea and vomiting, constipation, photosensitivity, so just make sure to wear sunscreen, sunglasses, and protective clothing, and also you can reduce the dose if it gets to be too much. You also can experience involuntary movement, paresthesia, peripheral neuropathy, poor coordination, and tremors. Please contact your physician if you are experiencing any respiratory distress, pulmonary toxicity, which is trouble breathing, fatigue, dry cough, discomfort or worsening of symptoms when lying on your back, congestive heart failure, worsening of arrhythmias, and please contact your physician if you experience any bluish discoloration of the face, neck, and arms, and it can be normally reversible. I know this is a lot of information, but do you have any other questions at this time?
Well, my husband and I were thinking about getting pregnant soon. Would it still be okay if I took this medication?
No, you need to discontinue this medication if you are planning or suspecting a pregnancy. And by discontinue, you just have to notify Dr. Tan and he will have you stop on the medication. Do you have any questions?
Would I have to come in for any follow-up exams?
Yes, we require every 3 to 6 months follow-up. And usually we do a chest x-ray, pulmonary function test. Do you have any other questions? I know you've answered a lot. I've answered a lot.
Not that I can think of. I do have Dr. Tan's number if I have any questions, so I'll just call him.
Okay, that's great. Well, if you have any other concerns, you can look at the handout I provided you, or you can also call Dr. Tan's office with the number they provided you with if you have any other further questions. Have a good day, Ms. Swiskid.
Thank you.
Yay!